welcome to the Better You podcast. I'm joined by Dr. Tracy Tilton and Robbie Patani. Ali will not be able to join us today, and we're talking about generalized anxiety disorder. Which right before this started, we were having a conversation because we've had to reschedule this recording so many times from technical issues here, there, and everywhere. And that's actually part of the reason that Ali can't join us, and I was just talking about how my anxiety for this recording has just gone through the roof because of the the constant rescheduling and just things not working out. But things are working out good enough. So with that, I'm gonna kick it over to you, Dr. Tilton, to just kind of talk about generalized anxiety, what the symptoms are, what how it's different from just your regular anxiety, things like that.
Yep. Yeah, I'm also going to touch on treatment and like prevalence, things like that as well. Um, so, okay, the diagnostic criteria for generalized anxiety disorder, which I'm just going to refer to as GAD because it's kind of a mouthful, if not, but um, the criteria for GAD to diagnose it is excessive anxiety and worry more days than not for at least 6 months. And then three of the following six symptoms: feeling restless or keyed up, irritability, sleep disturbance, such as difficulty falling asleep or difficulty staying asleep, muscle tension, and your mind going blank. So, and only one of those symptoms needs to be present if you're diagnosing an adolescent or a child. So they're a little bit different from adults, but and then the other criteria is that anxiety needs to not affect you in your social, occupational, or other important life areas to make a significant difference in those areas or a significant impact. And then the disturbance can't be attributed to any other disorder or physiological problem, anything like that. It has to just be um, your mind. so,
No,
um,
I sorry, I didn't mean to interrupt, but I think that that's important when we're talking about mental health disorders and tendencies, because I feel like one of the things that I see all the time, and I've gotten to the point where it just doesn't bother me anymore, but it used to really bother me, is people will be like, "Oh, I have this," and it'll be like, "Oh, I have OCD," and I'll be like, "No, you don't," because people that have it, like, it's a problem. And I think that it's it's very it's very recognizable with something like OCD, but with anxiety, it can be like far more nuanced because you talked about mind going blank and lack of sleep. These are things that if you're you know good at, I guess, coping mechanisms, you can still progress in your kind of recognize, hey, this is what's going on with me.
well,
um,
right. And that's a good point because to distinguish GAD from like worry or, not clinically significant GAD is that like non pathological, rather. The worries of everyday life and non pathological are not excessive and they're much more manageable than GAD. And when something more pressing arises, you can just put the anxiety out of your mind. Well, in GAD, you cannot. That's typically more severe level of anxiety about more life areas, and it's like always in your mind. I mean, it waxes and wanes to a certain degree, but it's always like right there. Um, and also, like you mentioned, sleeping. Um, when you try to go to sleep, a lot of times because we're so busy all day doing stuff that it might not really creep in sometimes unless it's really severe. But then when you're like at night, laying in bed, trying to unwind and not doing a million things, sometimes that's when it really hits you. And your mind just starts racing with, okay, what if, and this is going to happen. all this other stuff, and you can't sleep because it's so impactful.
I mean, but for me personally, that's how anxiety like really just gets me. There's other stuff where I feel like it's more manageable and I'm fine, you just kind of push through it. But the sleeping is just awful. Like I have terrible insomnia. If I wake up in the middle of the night, there's a 50-50 chance that I'm not going to be able to go back to sleep just because I can't shut my brain off.
Yeah,
Um,
very common with
so
anxiety.
yeah, I mean, I don't I don't know what the distinction is between sort of an insomnia or nighttime driven anxiety that's preventing you from resetting, or I guess kind of how we tend to think of anxiety in that it's preventing you from acting during the day.
Mm.
Is there like a different treatment style or a different approach that somebody might take based off of those differences?
No, excuse me. No, not really. I'm gonna go into treatment in very shortly, and the treatment for almost all psychotherapy, the gold standard is cognitive behavioral therapy or CBT. So it really for almost every disorder, that's the approach that you take. You could do a little bit different for like DBT for, borderline personality disorder, but there are still really a lot of commonalities between those two treatments. So for anxiety, it's either cognitive behavioral therapy or acceptance and commitment therapy, which I'll describe in more detail very shortly.
But
Okay.
for so from Psychology 101 from forever ago, I remember, the five schools, and I know that cognitive and behavioral are supposed to be two different schools. How does CBT work, I guess, relative to, I guess, me, a Psych 101
Right,
student?
just behaviorism or just cognitive. Yeah. Well, I mean, it blends the two, I guess, because of the name, I would say. And it's very research based. Um, and a lot of times it involves homework and, doing stuff outside of therapy. And it's very structured. Like there's manuals for it a lot of the time. Um, and some of the other types of therapies or orientations don't have that much structure, or they don't have a lot of research to support that it works. Well, cognitive behavior has like so much research, so that's the main difference. I'd say another thing that you can get when you have GAD is psychosomatic symptoms such as stomach aches, headaches. You get sweaty or dizzy, upset stomach, stuff like that.
Gotcha. On that note, would you consider having a anxiety like specifically through cognitive disorder, or has like there are also some cases where a physical condition will also play in the role?
Well, I mean, a lot of people who have anxiety have panic attacks. So that would be, physical symptoms
Hmm.
that basically it's like a fight or flight reaction in your body when you start to feel really anxious and you get like this intense surge of feelings and fears, and you get physical symptoms like some of them that I just mentioned, but your increased heart rate, your palms are sweaty, your breathing changes. And when your breathing changes to shallow breathing, we can't think as clearly because we're not getting enough oxygen to the brain as we were when we were breathing more deeply. So it's kind of hard to think clearly. And then people a lot of times really believe they're having a heart attack where they have a panic attack. And then they're start to worry like, okay, what if this is a heart attack? Or what if I have another one of these in public? Or what if I lose complete control? And their mind just goes down the rabbit hole. Um, they usually don't last that long, but they can be quite. They can give you a lot of. It's a lot of impairment for a lot of people. Because then some people don't even want to leave their house anymore because they're like, "What if I have one outside? I'll be so embarrassed." So, it can morph into agoraphobia, I guess, in the most extreme cases.
I was just about to ask that, like, because I feel like anxiety is this very prevalent thing in our lives, and no matter how good you are at coping with life, like anxiety is going to be a part of your life to some extent.
Yeah.
Um, but I feel like we all kind of develop our own coping mechanisms around our anxiety, some good, some not so good. Um, but does that like how can it evolve with, negative coping mechanisms in I guess what is the worst case scenario? How far can it go? Because I'm imagining, you know, like you said, agoraphobia or people having such intense anxiety that it's having physical effects, like measurable physical effects. But
Yeah. I
I
mean,
don't
some
know
people
anything.
get so anxious. Like I had a client who, well, it was actually the parents of a young woman. I mean, I think she was like 25 or something. So she, um, and she couldn't move out or like go out of the house or do anything because she was so anxious. And they're like, we're retirement age. Like, we want to move. We can't get her out of the house. And they're like, because she's like terrified by her anxiety. It's just, really made a huge impact on her, a negative impact on her life. So I worked with them, to some suggestions and, to even try to get her to come to therapy, which she wouldn't do because that involved getting in a car and coming. So then I suggested, remote therapy. And that was too nervous to talk to a stranger. Um, so it was like one thing after another. And actually that leads me to my next point, which is the cycle of anxiety and avoidance. So when there's a anxiety trigger, you get a lot of uncomfortable physical symptoms and you feel uncomfortable cognitively. And then, so you avoid whatever it is you were going to do that makes you anxious. And then that relieves your symptoms because you don't have to do it anymore because you're avoiding it. And then, you feel better briefly, but actually it just strengthens the anxiety in the long term because then when something comes up again, you want to avoid it again. And it just, the cycle that gets stronger and stronger and stronger. So a lot of people do use avoidance and, then they might not do things in life. Say you were anxious when flying and you wanted to go on this vacation and you just couldn't get over the anxiety to get on the plane. So, so the cost, even though you decide, okay, I'm not going, you feel better briefly, because the symptoms subside, you are missing out on life experiences that you want to do. So, you know, that's not ideal.
Hi everyone, I'm Allie Bailey, and now a quick word from us.
Howie Mandel here. Do you ever feel like you're just another ticket in a long line, especially when you're looking for help with something as personal as your own mental health? Lamco Wellness is bringing the human connection back to mental health care. It starts with a personalized intake process where they get to know you. They offer medication management that's actually managed, coordinating with you and your clinician to make sure you're both empowered and on the right track. It comes down to three things: personal connection, compassion, and absolute privacy. Stop being another number and head over to lamcowellness.com to take the first step.
All right, everybody, now let's get back to the podcast.
Would you say at times, or I don't know what the research says, but do you think most people have anxiety at birth, or is through their life experiences that they have?
That is great because one of my talking points is that most people, when they report that they have, severe anxiety, will say they've had it their whole life. Now, the mean age of diagnosis in the U.S. is age 35, but I diagnose adolescents with it because I mean they have so much. A lot of adolescents is social anxiety. When they're gonna fear, their fear is of like some kind of performance or that they're going to be negatively evaluated by other people. Um, so they like make up excuses not to go to school or things like that. Um, but most people, I mean, it's chronic, but at the same time, it waxes and wanes. Like it will get really severe and then not so severe for a little bit.
Hmm.
And the 12-month prevalence, is 0.9% among adolescents and 2.9% over men and women in the general community. It's also more prevalent in people of European descent rather than Asian or African descent, and people who come from higher income countries rather than people from middle and lower income countries. So yeah, and women tend to get it twice as much as men or male adolescents.
So I have two questions. One is, do you think that that is the diagnosis is more of a cultural thing, or I think it's uh, weird effect? Uh, I can't remember. There's an acronym, but for white industrialized um, affluent countries.
Yeah.
Um,
Oh, definitely.
but
100%.
okay, okay, because I mean I can definitely my family is Japanese, and I can definitely see the anxiety still being there, but also like, no, you just have to go in that culture.
Yeah,
Yeah.
or maybe some cultures are um, less likely to seek out help. So it doesn't mean that people aren't anxious. It just means maybe they don't believe in mental health treatment, or they can't afford it, or it just seems scary to go and talk to a stranger. I mean, usually if meet with someone a long time, you have rapport and you feel like you get to know each other. But it can be a bit intimidating just to go in and talk to a complete stranger and tell all these personal things that are going on, or intimate details about your life, that are contributing to the anxiety.
Absolutely. And
Yeah.
that kind of brings me to my second question. I don't know if it's a question so much as a statement, and then what are your thoughts? But I was um, I was reading Meditations by Marcus Aurelius not too long ago, and like it's very interesting. But the in it he talks about his habit of doing something uncomfortable for him every day just
Hmm.
to develop the mental resilience to kind of push through when things are hard.
That's great.
Is that sort of thing recommended for people with anxiety?
Um, yeah, it is. A lot of times with anxiety treatment, people will do a hierarchy of fears. So you write down from least something that makes you the least anxious to the most anxious. Say someone's anxious about like riding the train, then say that's what they get most anxious about. So we'd go through the other things and do it kind of like imagine you're doing this, and then this is what happens, and this is what doesn't happen. So then you start to learn, like, okay, the worst thing I'm imagining is not coming true. So, and then at the end, like you would go in vivo or do exposure therapy and ride the train with your, um, and then, then the next time the goal is that they would ride it alone. And hopefully, because of all the work you've done prior to that, it's not like gonna freak them out too much, especially if you're there the first time or something, then that can really be effective treatment.
Yeah, why do some people have it much more worse than other people? Is there a commonality between those two, or is just a difference between men and women? Um,
Yeah, that's a great question. Well, younger adults tend to have more severe symptoms, um, and they get more anxiety around like their appearance, performance anxiety, school life. Anxiety tends to be age appropriate. So then adults would worry more about like finances, their kids, their relationship, work, all that stuff. So it's not so much that like in terms of why some people have it more severe. I don't know if it's because they've been avoiding it, doing that avoidance anxiety cycle that I talked about earlier, and that just strengthens it and strengthens it and strengthens it.
hmm.
So that would be, I think, the most logical conclusion about that.
On the culture note, I'm gonna have to ask my mom what anxiety is, or what she thinks anxiety is, because I'm sure she doesn't know what it is at all. Uh,
A lot of people don't really. And I'll be like, once you worry, when your worry is out of control and you have like a sense of impending doom, or you're so dreading something that like it almost like can paralyze you to a certain extent. Um, I think I was anxious to do this today, but you know, I did it instead of avoiding it. So that's a better approach. Um, and then for risk and prognostic factors, temperamental and environmental factors are the
Can I
key.
can I stop you? Pardon my ignorance. What is prognostic?
How do you predict who's going to get it?
Okay. Thank you so much. Sorry, I was just like, I don't know
That's
what
okay.
that
I
word
mean, there's
means.
easier way to say some of this stuff. In layman's terms are probably better route to go. Um, so temperamental factors such as like harm avoidance, reward dependence, and attentional bias to threat, which means if there's a threat, you really, really focus on it. Now, environmental factors are more like childhood adversities and parenting practices, like if they're over controlling, they or overprotective, they reinforce avoidance, stuff like that. Um, and the genetic inheritance factor is one third, and it's shared with other anxiety disorders and mood disorders like major depressive disorder. So it's not a tiny amount of genetic contribution, but one third. I mean, it's not insignificant either, and it does tend to run in families. We see that all the time.
So I do with that, and I've heard that, but I also um, am kind of interested because I have family members that have, young kids, and I have seen their kids become more anxious as they spend more time with anxious people
Um,
um, that they're related to. And there's a part of me as I'm watching this and not saying anything about it because it's not my business, but
right.
there's a part of me that wonders like, oh, how much of that is because, oh, that's her daughter, and how much of that is because she's seeing mom be anxious and that's the learned behavior that she's expressing and it's normalizing in her head.
Yeah, and then they internalize it, and there you go. It's off and running. um, let's see, what else did I want to say about this? Oh, in terms of comorbidity, with women, comorbidity is generally confined to other anxiety disorders like panic disorder or um, sometimes, well, I want to say PTSD, but anxiety is always a part of PTSD. So if they have PTSD, you should diagnose that over generalized anxiety disorder. But um, so in men, comorbidity, meaning like other disorders they have, is more limited to substance use disorders, whereas women it's mainly like depression. So
Oh, oh,
deal with it in
sorry.
different
Go ahead.
ways. You can have increased suicidal thoughts on generalized anxiety too. So I mean, it can be really serious. I mean, people are like, "Oh, you're anxious, so you worry a lot. What's the big deal?" It can, totally paralyze and limit what you do in life. And then people, sometimes get suicidal ideation after that.
That's, I
Yeah, and
mean,
it's associated with significant disability. Like US, there's 110 million disability days per year in the US population. And that means like it's decreased work performance, it's increased medical resource use, it's increased risk for coronary events.
is this per person has on average 110 disability
No,
days?
the whole US. Like that's how many people take days out of work because of their anxiety. It can be very disabling, and they're not
Okay.
performing good at work, and they're going to the doctors more, and things
So
like that.
I with that. There's a couple questions I have. But with that, I did want to I did want to talk about kind of the other side of it that I've seen. I've experienced.